gastroenterology has always been interesting. I had several cousins with GI disorders, and so I was always interested in the field in general. But it was really in medical school I had an experience with a GI doctor who was taking care of somebody who had traveled from Alaska and explained to them what was going on and did it in a way that really helped them understand that we know what's going on in your body. We have lots of ways to understand it and to treat it. And you don't need lots of tests. You don't need lots of traveling to different places. We can help you with this. I'm John Rosen. I'm a pediatric gastroenterologist, and I focus on neurogastroenterology and motility. The patients that probably affect me the most are the ones that have had trouble in the past. Maybe they've seen doctors outside of the city and they've come here for comprehensive help. And children with Hirschsprung's and short bowel syndrome, for instance, they're dealing with lots of different issues at the same time. Their families are stressed. They're dealing with lots. They've seen lots of doctors, had lots of tests. And there's been several of those patients that I've managed in neurogastroenterology clinic, motility clinic, or in the colorectal center. We're making it possible for the family to function. They're enjoying their time. They're out of the hospital, which is huge. And those are the things I think are really satisfying. These really complex patients, they've been dealing with things for a long time, and I think we can really advance their care and make their lives better. We have resources in place to help children and their families who are dealing with these uncomfortable symptoms or conditions like constipation or fecal incontinence where they can't control their poop. Nobody wants to talk about that with your friends at school, whereas you might talk about a rash that you have or your asthma. And one of the things we do as pediatricians and pediatric GI docs is explain how common these things can be. Children's Mercy is this amazing place that has all of these resources, but I think one of the special things about Children's Mercy is how we use those resources, how we're not going to do things that we don't need to do because we know how that affects children and their families, but we have all these tools available and we know how to apply them. I think the approach of a Children's Mercy physician is to make sure we're open to possibilities that we don't understand, that we address those with other experts, because no one doctor knows everything. And I think if you come to an institution as a patient, you want them to be open-minded, to have the expertise, but not to think that they know everything about everybody. And I think we do a really good job of that at Children's Mercy, is really helping the patient and that specific patient, not having a formula of what we need to do for everybody.